Hi, I'm Jennifer Beale. I work for Signet Healthcare. I've been supporting transition to a smoke-free hospital, and of 61 patients, 33 smoke and 30 use e-cigarettes. Although I recently had a conversation with Professor Watkinson of chemistry at Queen Mary's University, and he said nicotine is more toxic than cyanide. And he's put the fear of life in me for supporting people with nicotine use. I just wonder people's thoughts on this, because this wasn't a Daily Mail person, this was a professor.
I think being a professor doesn't preclude having idiotic beliefs. It really doesn't. Where do you start? Andy McEwen from the NCSCT said very wisely that people are entitled to their own opinions, but they are not entitled to their own facts. And I think that sort of statement that he's made, it isn't grounded in facts, and it does need challenging. But of course, until we kind of catch them doing it, they just carry on doing it. So, we know from our service users that if they're patients at our hospital, our acute and secondary care trust, they are likely to be told all sorts of damn stupid things by their doctors and their primary care physicians as well. And we've had many people come and say, well, my doctor said that you can't vape and smoke at the same time. It's very dangerous. Or you can't vape and use NRT at the same time. It's very dangerous. A vascular surgeon who said that if it was a respiratory disease that the person was suffering from, it would be all right to vape, but you absolutely can't do it if you've got a vascular problem. Now, where has that come from? It's a fantasy.
I would just add to that, dual use is actually quite common when people are trying to transition, so we shouldn't worry about that. Whenever you try to change any behavior, like if you tried to change your diet, you would not ever stop eating ice cream, or you would cut down, but you would. So don't worry about dual use. The other thing is we actually have studies that show harm reversal, where using vaping products result in harm reversal. There's a study, COPD clears up, much less symptomatic. In asthmatics, these are done in Italy. Riccardo Pelosa, who's one of the major researchers, I would get those studies into that person's hand. This is remarkable that we can actually reverse harm now. And then the last thing is, nicotine is here to stay. It's not going anywhere. We're never going to live in a nicotine-free world. Sorry.
Hi, Andrina from Homerton Hospital Stop Smoking Service. I just wanted to mention, in Helen's presentation, she was saying about the pictures that we have on the cigarette packets and things like that. I just wanted to say that young people find it quite useful, and from an educational point of view as well, the pictures are actually quite helpful for young people to not take up smoking in the first place.
I find that hard to believe. I think, at least in the United States, the reason people are not taking up smoking, and it's worked quite well, is just a kind of a straight-up public health campaign. We don't have, at least right now in the United States, packages with gruesome images on them, and the rate of smoking among young people is at historic lows. So there's a way that you can do that without shaming smokers and showing them bleeding and tumors. And I just think as a society, it really bothers me that we think we can do that to try to get people to stop a behavior. There is a better way, I think. I'm curious to know what other people think about that as well. There might be more opinions on the packaging.
Hi, I'm Frank Ryan. I'm a consultant psychologist in Camden, Islington, Mental Health Trust, not too far from here, for those of you who are not local. Just a quick comment on the packaging, the logos, and then a question or for discussion about vaping in mental health settings. I actually feel that the health warnings are appropriate. I think we need to view that in the context of the standardized tobacco packaging which came in this country. I'm not sure whether you have that in the US, but now all you see in a tobacco product is the health warning, and that there's psychological evidence to show that prior to this, the logos were distracting young people in particular from the health warnings, be they graphic visual images or text. So I feel, and you just need to look how hard the tobacco industry has fought all over the world to stop this happening, to know that it's anything the tobacco company doesn't want, you know it's the right thing to do. So I think make the health warnings as graphic as possible. Now, moving quickly on to vaping in mental health in residential or inpatient units. One of the learning points for me today was that you reminded me, Louise, that vaping is more a form of grazing where one ingests nicotine in a very gradual and constant way. Now, this presents really big problems in a mental health setting. In Camden Islington, I'm just about to introduce free-to-use e-cigarettes across 16 inpatient psychiatric units. And at the moment, the rules suggest our rules are that we allow smoking or vaping rather in patients' own rooms. And I think virtually all of our inpatients have their own rooms. But that really isn't sufficient. That doesn't seem that would work. So I was wondering really, for considering the other views around the group, yourselves and on the panel and others in the audience, may have some suggestions as to what would be an acceptable compromise, noting that some staff and other service users do find vaping rather intrusive, and there's an etiquette to vaping. One shouldn't be, if we had lots of vapors in this room, we might find it a bit distressing or off-putting. So it's really just a question of, I suppose, to put it in a simple question is, where should we allow vaping? Where is it permitted in situations like inpatient psychiatric settings?
Really, really good question, and one that we've grappled over the last few months. And I may ask Mary to make a comment, because I know her approach at SLAM is very different to ours. I've tried to make it as liberal as possible, but as I said in my talk, I've come up against people who want to make rules. I don't think it's appropriate to only have it outside. One of the biggest problems is smoke detectors being set off. Now, I didn't think this would happen, but in fact it does. If you have an opacity, one where a cloud of anything, even if it's like deodorant, will set it off, that is a problem, particularly at night if it sets off a fire alarm and everybody's got to be evacuated. However, on one of the rehab units, they were having so many problems with patients asking for Section 17 leave, 20 times a day to go out for a cigarette. We made a compromise that if they transitioned to vaping, more or less exclusively, and stopped asking for Section 17 leaves, which then tied up a member of staff to have to go out with them, a much, much more liberal approach would be taken. So people could vape anywhere they liked, as long as they didn't really annoy people with big clouds, certainly at the dinner table, that sort of thing. They could continue to vape during therapeutic activities. Staff could vape as well inside, which was a big breakthrough. To role model, if staff could show that they could vape instead of smoke, that would encourage patients to think, well, not such a bad idea. And in fact, there hasn't been a single complaint. It hasn't entirely worked, because there are still some that still want to smoke and they're still asking for Section 17s. But I think it's moved things on faster than a restrictive, 5 rules about where you can do it and where you can't. Just leaving it to evolve has been quite a helpful way forward. I don't know if that helps.
Yeah, why can't we just have vaping lounges? Just like there used to be smoking lounges, change them into a vaping lounge, And I just want to say, I feel like so many images that we see of vaping are those massive clouds, right? And people get annoyed because it does invade your space. But the reality is most people are not into blowing clouds. The vapor is, unless it has a flavor, it doesn't smell, and it dissipates very, very quickly. So those photos of those massive clouds, that is the exception. Most people that I know who vape and I see out and about, they're not blowing massive clouds. I somehow think that's deliberate. They're publishing these photos to make people think, see, it's just like cigarette smoke and it gets in your space. And
hi there, my name's Patricia Ritchie and I work with Hounslow. It's really just going back to the graphic pictures on the cigarette packets. This is a sort of personal observation. My husband has just come through a massive operation for oral cancer. He hasn't smoked in 32 years. He was a smoker in his teenage years for a very short space of time. Each time he goes to the doctor or the consultant or the hospital, are you a smoker? Have you ever been a smoker? He's not been a smoker, as I say, longer than he ever smoked. But what's upsetting to me with the cigarette packets is he had his operation in April, and it's still quite raw. And when I was walking down the street the other day, someone had also littered, thrown their cigarette packet on the ground, and lo and behold, there's this horrible picture of someone who's had oral cancer, and that's sort of staring up at me. And I'm not the only one, and I'm sure there's lots of people who have family and friends who have had oral cancers of some sort, really don't want to be faced with those sort of pictures, whether or not the person has gotten the cancer from smoking or not from smoking. And as far as I'm concerned, no one can actually say to me that my husband got that oral cancer because once upon a time, many moons ago, he had a cigarette. You know, I just find it quite offensive, the pictures. And I think people should think about that as well, you know, when they're putting these pictures on. It's not all about frightening people to stop smoking. You know, it can be offensive to other people. Thanks.
Thank you. Zenia?
Hi, I'm Zenia Kumian from the Public Health team at the City of London Corporation. Something that you alluded to, Helen, around nicotine being able to sort of suppress appetite and looking at smoking and sort of the wider social determinants of smoking. Is there anything that's been done to look at introducing vaping around kind of tackling obesity at all?
there are studies, actually, and they're using nicotine to help, to see if it would help with appetite suppression in people who are overweight. Yes, that's happening.
And from a simply an experience point of view in our service, we've had particularly women say that on this quit attempt, because they were vaping, they didn't put weight on like they had before because they weren't binging on chocolate and sweets and stuff.
Sorry, yes.
Hi, I'm Jacqueline, and I lead Nesta UK's work on social movements. I have two questions. The first question is, I come from the world of innovation, and we know that innovations can often lead to inequalities. So I'm curious to hear what inequality do you feel e-cigarettes could lead to and how we might mitigate that from the get-go? And the second question is that vaping has been referred to as a self-help, consumer-led social movement. To what extent can this particular movement around vaping actually build on previous smoking cessation and tobacco control movements in terms of the infrastructure that it's built, or do we have to start from scratch?
Sorry, just remind me the first bit again, which I think was a slightly easier question to answer.
About many innovations leading to inequality if the spread of them isn't managed properly.
Yeah, I think it's a very interesting one, because certainly many of our service users say they'd like to try an e-cigarette, but they can't afford to take the risk, if you like, of lashing out 20 quid on something that may not suit them. And so we've, for some time now, supported them by giving a free sample away. I was very fortunate to be given a lot of freebies after one of the e-cig summits, and then we started, buying them in smaller and then greater quantities, and asked people to consider making some savings during that first few weeks when they were using it, and then using it to buy something better for themselves, and that seems to work quite well. But that's obviously the risk, that if you need 20 quid in your pocket to go and buy something, it's the poorest in society that are going to get left behind. So I think the services have to do something to close that gap. Now, it brings into question the thing about a prescribed e-cigarette, and I've been asked this a lot over the last few weeks, especially for some reason. What do I think about prescribed e-cigarettes? I'm not particularly in favour of it because I don't think it's a medication, but people make the argument that if you can prescribe, it does get them into the hands of people who can't afford to buy. But I think there are better ways of doing it. I think the diversity, and you talk about innovation, the diversity of models, of looks, of flavours, of colours, all that is what makes them appealing. If you have a standard medicalised model, I really don't think it's going to fly. So, it has to remain a consumer product in my mind. I'm not particularly interested in a prescribed model, but other people may disagree, from the floor, or I don't know. What do you think, Helen?
Could we have both? Could we possibly? Yeah, I think that in terms of innovation and inequality, it exists now. I mean, it's the reality. People who are transitioning tend to be, they have more money, they're white, they have access, they can go to vaping bars. We have several in New York City. It's expensive, and so always with any kind of medical intervention, poor people, people of color, are often the last ones to get life-saving devices, medications, etc. I think that one thing that could equalize it, unfortunately in the United States, we have a massively dysfunctional healthcare system. We don't have a national health service in the United States, which really, really complicates it. But if the insurance industry, if we can't get rid of them, if they would cover electronic cigarettes as they cover patches and gums, that would be huge, because then in the United States, people who are very poor get Medicaid. That's a program, a health insurance program, and Medicaid pays for patches and gums and Zyban and the medications. If we could get health insurers to pay, that could equalize it, because then they would just go and get their electronic cigarettes at the pharmacy. And then the other point, I mean, I think we're seeing the beginning of it. We have to have a movement of people who vape to fight against the junk science that is out there, to expose the junk science, to advocate for everybody who wants to vape to be able to afford these products, to make the lives of the people who are passing all these terrible laws against vaping hell, and say, we're going to live and we're going to get these devices and we're going to vape. So we need a movement of people who vape, and in that movement, we have to make sure that we are raising the demands for people who are the most affected, people who have mental health problems and are homeless and drug users, that they are included, that we make sure that they have access to these products. So I think a movement is really important. We have one organization called Consumer Advocates for Smoke-Free Alternatives. They have something like 10,000 members. We need more organizations like that.
I think the other issue, I've just been thinking about it while Helen was talking, the other inequalities issue, in my experience, is the lack of internet access. People who are internet poor, if you like, they don't have smartphones because they can't afford them. They don't have the capacity or the ability to just search for the technical problem-solving issues on the net. And we all know it's just so easy to pick up a fag, put it in your mouth, light it, and you're away. But with an e-cigarette, you have to be comfortable with the technology, and an internet-savvy person will do searches on that. They'll look at YouTube, they'll join forums, that sort of thing, and poorer people may not be able to do that. So that maintains the likelihood that they'll relapse to smoking, and things like being organised to have a spare battery that's charged up. All those things, I think, there's a layer of vulnerability. Your other question, which I think kind of needs an essay to answer, it's a very good question, but I'd have to think a lot about it, about where you take this. I think, from my point of view, one of the key aspects is stop smoking services, doctors, other healthcare professionals, policymakers, politicians, the rest of it, getting out of the way of people who can organise their own lives, and just stop putting barriers and fears into people's minds, encouraging this cultural transition rather than focusing on the fears, the risks. Just get out of the way.
I have 2 points really. Going back to the topic of the packaging, I know that my dad smoked for 55 years, and he's always known that smoking kills, but that packaging didn't really make a difference to him smoking. But for some people, it might have changed their way of thinking because that may have been the education that they needed. So really, the issue of the packaging, we can't really win that one. But another point that I wanted to make was I went for a refresher for Stop Smoking service, and not a lot of information was given on vaping. I think the lady spent about 2 minutes on vaping, and that was it. And I was just wondering, is this something that's going to be, introduced more into that program?
I know that the National Centre for Smoking Cessation and Training is about to launch an e-cigarette learning module, which I'm a reviewer on, and I think it's very good quality. It involves an experienced vapor talking about his journey. It problem solves. It gives encouragement to practitioners to open their eyes and see potential. So I'm really hoping to see it launch very soon.
Thanks, Jerry Stimson, Professor, and thank you both very much for very stimulating presentations. To Louise for pioneering the world's first e-cig friendly smoking cessation service, and to Helen for really giving us a presentation which is straight out of the kind of public health HIV prevention playbook. It's exactly the same sorts of challenges about reaching out, understanding what populations are doing, meeting people where they're at, and providing the awareness, but also the means to change behaviour. And when e-cigarettes came along, every public health director should have seen that, but unfortunately, every public health director, nearly every public health director in the UK resisted that, even though many of them had been highly in favour of harm reduction for drugs and many in favour of drug policy reform. And of the 150 or so public health directors in the UK, till now only 2 or 3 have spoken up or written publicly in favour of e-cigarettes. Vast contrast to the response to HIV. So that's a kind of a bit of a dismal story there. But I wanted to think a little bit about this issue of stigma. And we've heard a lot about the plain packs and all the rest of it. And there's kind of opportunity cost and what are you going to get your return from? And with graphic warnings, even the best estimates from the RAND Institute on the Tobacco Products Directive directive was that graphic warnings would potentially lead to about a 0.5% reduction in prevalence of smoking over 5 years. So we're getting better returns on other things, and we really need to switch away from the kind of the sticks to carrots, because what's happening here with e-cigarettes is when people are given the opportunity, there's a huge appetite to switch. You don't need the stick so much as the facilitation to change, and people are changing when there's the opportunity to change. But I wanted to come back to this issue of stigma because, well, public health policy has deliberately used stigma in the field of smoking to bring about change, and that's rather peculiar because, as you said, in most other fields of public health work, we're against stigma. We want to engage and facilitate and so on. But I wonder whether when people switch to e-cigarettes, whether there is still a lingering stigma. I mean, for some it's a transformation. You know, I'm no longer a smoker, I'm a vapor, and vapors are not quitters. And so for many people it can be a positive move. But is there still an external stigma that you're still doing something that's not really nice or proper? Is there still a stigma from others that you're still a nicotine addict? I mean, is there still a fear that people are, well, they're still addicted to, they're still junkies, they're still addicted to nicotine, even if they're using it in a cleaner way. So is that there, and how do you deal with that kind of residual stigma that might happen to people, even though they've made the switch from one activity to another?
I think you're absolutely right, Jerry, and I think it depends on the person's social circle. In Leicester, you see people, I think you see more people vaping than you see smoking, but there's a really good proliferation of shops. We have posters up in the city centre, time to switch, all that sort of thing. So I think Leicester is quite unique. But in people's families, particularly in disadvantaged communities, service users will tell us, or my wife or my husband or my son, says, you've got that damn thing in your mouth more than you ever had a cigarette, not understanding that, firstly, that's how it works, that you do sip more often, but also they may be using too low a strength. So the advisors are the ones that actually, firstly give them a script to challenge back or push back, to the people criticising them, but also encourage them to maybe up their strength so that they're not having to puff quite so often. That I think makes a difference. But yes, I hear many people say, oh, they look so stupid with those in their mouth, it looks like a dummy. I did a talk on Talk Radio at the beginning of Stoptober where the interviewer said, it's just like a dummy that they have in their mouth. And you say, well, just, be a bit more respectful because they are actually trying to avoid getting cancer. So shut up. Shut up.
Yeah, I guess the packaging thing that's on people's minds, and I'm wondering if you would be in favor of putting those sorts of graphic warnings and gruesome photos on packets of cookies and cakes, because we have an epidemic of obesity, at least in the United States, and so would that work? Would a person say, "Oh my God, look at that"? Heart is exploded, or would you be for that? There's other examples that of things you could put on packages to, try to get people to not eat so much sugar, and then of course the sugar industry would fight you tooth and nail, right? Because they want us to eat as much sugar as possible. I'm just putting that out there for people to think about. I think there is a stigma around electronic cigarettes, and I think in part it's because of all of the misinformation and the lies about it. That's one thing. Another thing, at least in the United States, is we are still, unfortunately, all about abstinence. It's all or it's nothing. The idea of harm reduction, we've made some headway, but not nearly enough. So, okay, you said this earlier, Louise, some people were saying to you, okay, you use it, but right away start cutting down. You got to get off. And maybe you can do the zero nicotine, because you can get cartridges with zero nicotine if you just want to continue. The ritual is so satisfying for people, but even that is not okay. You got to taper down. We tell people who are on methadone that. We tell people who are on buprenorphine that. And we have to challenge that idea that some people will want to use it and it's helping them, it's not hurting them. So I feel like because we're so wedded to abstinence, even moderate drinking is controversial in the United States. People don't think if you've had a problem with alcohol, you can actually learn how to moderate it. Actually, the vast majority of people do. So that is something. And then the other thing to just add into that is we all take drugs. We're all drug users. You're using nicotine. I have a medication for arthritis. You have one for, we live in a world that is saturated with medications, and everybody is using something. I had some tea. I had coffee earlier. So let's just acknowledge that. We all use drugs. Some of them are legal, some of them are illegal, but we're all using something.
Sorry, is it on? Yeah. I just had a point to raise in terms, Rebecca Taylor from University College London, in relation to the health warnings. And I was involved with a revision of the tobacco directive. And I think there's a difference between, one thing we did in that was to ban the packaging that looks like perfume. And I think that was very enticing to particularly young women to have cigarette packaging that's very attractive, and it doesn't even look like cigarettes. But I think that's a very different issue to putting gruesome images on a packet. Certainly the very attractive packaging it's designed to attract people, but I'm not sure that the gruesome images, certainly they don't stop existing smokers from smoking, and apparently the evidence is they don't stop that many people from taking it up. But I think it's a different issue when you're talking about banning packaging that is very, very attractive and meant not to look like cigarettes.
Mm-hmm. I'm personally more concerned, in a way, about the labelling that is required to be put on e-cigarettes and their paraphernalia. Why should the liquid carry a warning? This product contains nicotine, which is highly addictive. Even on 0 milligram nicotine. It's clueless.
Charlie Hamshaw-Thomas, new nicotine consultant. Thank you very much, both of you. A simple question. I'd also be quite interested to hear the views from people in the audience who are still on the fence, as it were, about whether vaping is a good thing or a bad thing. What would you like to see the industry do more or less of? What would you like the suppliers of these products to be doing? I've heard you talk about giving out more free product to the disadvantaged, but there's a plethora of things they surely could be doing. What would you like to see them be doing?
I want to see the independent sector thrive. So I'd quite like the tobacco companies not to act in a predatory fashion and swallow up the independent companies. I think that they need to, I think, I know that a lot of the independent companies have tried to approach public health departments and stop smoking services, and they've been rebuffed. So it's not their fault. It's our fault, if you like. So they need to be able to carry on trying to work locally with with services that access smokers and create a partnership. But that's very difficult to actually mandate. I'm not sure what else. Have you got ideas, Charlie?
Licensed products, making the products better and better, informing consumers, sending the public health message. There's masses of things they could be doing, helping the retailers, helping consumers, making sure that all products are meeting standards and all the rest of it. And you're seeing all of the blatant abuse going on in the marketplace at the moment where people are just trying to make some money. Why fiddle over this issue of who owns vaping companies rather than concentrate on taking vaping mainstream, totally mainstream? Who owns it in 10, 20, 30 years' time? Why does that matter?
It actually matters to ordinary citizens. We certainly feel a preference amongst people that we talk to that use our service for non-tobacco industry products, and I respect the people that are here, that represent, other sections of this industry, but that there's a very strong feeling amongst some people who are trying not to smoke, that they don't want to use a tobacco industry product.
But won't the consumers decide that?
I'm talking about the consumers. But if there is no independent sector to use, then they have no choice, do they?
Yeah, but you're talking about tobacco. Tobacco ends up owning the entire vaping industry. Why is that a problem when vaping is mainstream and it's absolutely everywhere? Why does it matter?
Can I jump in? Hi everyone, I'm Jimmy Rushworth, the Partnership Manager for Kick It Stop Smoking Service. We work across 4 boroughs in central West London. And jumping on the gentleman's question next to me, I think we were approached recently by a stop smoking, a vape store. And as the Partnership Manager, I went and met the gentleman. And I think as a service, we almost felt stuck between a rock and a hard place a little bit in what we could do with them based on our policy and our public health policy and national guidance and everything else under the sun. But then equally, we were looking to engage with a vape store, and they were a very reputable one. The guy was really honest, and I had a good vibe in the meeting, if that's what you want to call it. But I think we were looking at things around staff training in the store. Now that comes down to the retailer rather than whoever produces the cigarette in the first place. But we were looking around whether we could train those people in level 1 smoking cessation. So they had some idea around reduction in nicotine levels and so on. And they offered 0 milligram liquids and stuff, which is great in that they do that, but they're still businesses, so they still need to sell their liquids at the end of the day. And I think we get into a slightly difficult area where if we're a service and we're prescribing someone patches and dual combination therapy, that'll be for 12 weeks. And they'll be seeing a stop smoking advisor during that time, and they'll be reducing their nicotine levels over time, hopefully, if they're going to achieve a 4-week quit, to the point where eventually they're not dependent on any nicotine products. And at the minute, we're in a situation, I think there's 3 million people vaping, I might be wrong or right in saying that, going into vape stores who aren't getting the same, probably, quality of support they would get from a level 2 trained stop smoking advisor on the high street. We're based in Hammersmith. There was one opened up the other day that was giving out half-price starter kits. And there's already probably 4 vape stores within 100 yards of our office, which is great to see. If people are going there, and they're going in there, they're going from smoking cigarettes to then smoking, or vaping, sorry, e-cigarettes, and they're going down to a point further down the road where hopefully they've got no nicotine addiction. But if we're not getting people to that point, then they've still retained that addiction. So I think upskilling staff within those vaping retailers is a good point. I don't know if anyone wants to say anything to that, but I did have a question of my own, which I think is probably more relevant, probably for Penny and Louise. So we were really lucky at Kick It last year. We had Andy McEwen from the NCSET come down and speak to us, and he highlighted a lot of the great work Louise is doing. And we, after that, I guess we made ourselves what you would call a vaping tolerant service. We can't prescribe or encourage the use of e-cigarettes, but we could, if someone was already vaping, they came to see us, we could offer combination therapy, we could support them throughout the process. Now, off the back of the recent Stoptober press release and how Public Health England have started to back vaping, we're reviewing our policy, and I think we really want to try and find a way to support people who are vaping or who want to vape, because we want to help residents quit smoking. But outside the context of the perspectives of directors of public health and councillors and heads of stop smoking trust, NHS trusts that we work with, or governors of prisons and the healthcare team within them, as a stop smoking service, what can you do? Is it just a constant suggestion of having negotiations with those commissioning teams and asking them if we can start prescribing stuff? Or is there anything more proactive we can do to encourage those, or find a way to support those residents? Sorry, that was really long-winded, I know.
No. I think if you're working with commissioners who are very, very uncertain how to go forward and don't want to give you permission, my advice would be to ask as few questions in terms of permission as you can possibly manage. Just do it. You know, start small and capitalize on what you learn as you go along. So, you start by talking positively about vaping with your, with people who want to know about it. And you find out what the results are with those. So you track, you have to track your results anyway. But, look at your success rates. Where is the best success? And it was very clear within the first 3 months of us doing that the vapors did better. It doesn't suit everybody, and I've made this point many times. Some people, just don't get it. But we got better success rates once they added vaping to whatever else they were doing, whether it was using NRT or Champix or nothing at all. And so you go back to your commissioners, say, look, these people only use this much NRT instead of this much NRT, and that many more actually got to a 4-week quit. What are you going to do about it? And you provide then a performance-related success story and an economic success story, because of course they go on to buy their own e-cigarettes. You're saving on your NRT budget, and that persuades commissioners more than arguments about the moral right of using vaping. Does that help? And build on your success, obviously. Once they sort of take the brakes off a little bit, you can just keep pushing that bit harder each quarter and go back with your results. And I can promise you that over 3 years, consistently, every single quarter, it's the vapors that have done better than the purely NRT people.
I wanted to just come back on this question about the industry and big tobacco. I mean, we're talking about capitalism, and I don't know if you heard the announcement, but Philip Morris has given $80 million to the Foundation for a Tobacco-Free World. And so they have given this foundation $80 million to do research on vaping and developing new products and doing research, and they're a player. There's just no way around it. The tobacco companies want to control nicotine. They want the profits. And they're saying, whether you believe them or not, they want to move to a smoke-free world where the vast majority of people would vape to get their nicotine, not use combustible tobacco. Now, if that's true, that's awesome. I wish in a perfect world that we didn't have these corporations that care more about profits than people's lives, but the reality is they're here. And are they sincere in moving towards a smoke-free world where people vape and they don't use combustible tobacco? I think some people in the industry want that because they're still going to have customers. And that's a reality. I'm uncomfortable. There's all this promise and hope, right? Because they have the money and the technology to move people and to market them towards these products, right? I want small vaping shops to still be in the picture. I think there's a role for that. The last thing I'll say is I think I want us to stop using the words quitting smoking, smoking cessation, stopping smoking, and instead say tobacco harm reduction. I think it's a much better way to think about what we're trying to do. We're trying to reduce the harms of smoking. We're not telling people to stop or to quit. That turns people off when you say cessation. When I do groups, I never use those words. I say tobacco harm reduction. So I just offer that to you. Say tobacco harm reduction. You ask people, what do you want to do in terms of your smoking?
Thank you very much. And if you join me thanking the speakers, thank you.
Thank you.